Hello, and welcome to this video on water fluoridation. Water fluoridation is a contentious public health measure. Used in drinking water, it universally delivers a small quantity to everyone. This occurs where water is not naturally fluoridated. It is a method of reducing cavities. This is a somewhat contested conclusion. Others have even more imaginative applications for fluoride. Fluoride is an element on the right side of the periodic table. It has 7 electrons in the outer shell, making it less reactive than most elements, but more so than others. It is normally added to water as a compound. The 3 most common are sodium fluoride, fluorosilicic acid, and sodium fluorosilicic acid. These are readily soluble in water. It does not affect taste, and it does not affect color. There are also no known adverse health effects at concentrations in water. Both in the USA and Europe, it is considered a beneficial nutrient. Fluoridation is an artifact from the past where fluoride was not available at a consistent level. Dentistry and cavity management treatments were limited. This had a direct effect on the retention of teeth in adults and children, along with overall oral health. The primary focus of fluoridation is children. They have the greatest benefit from fluoridation. Their teeth are still developing and growing. The outer shell of enamel is not yet established or stabilized in the same way as that of an adult tooth. They also have more pronounced preferences for sugary food. This acts on the key aspects of teeth caries. These will be detailed later. An adult has established teeth with greater enamel content and better oral hygiene habits. They also prefer salty over sweet food. This means they gain less from fluoridation than children would. The general rate of administration across the world varies between 0.5 mg a litre and 1.2 mg a litre. In the USA, they advise no more than 0.7 mg a litre. Europe advises a minimum of 0.05 mg for each kilogram of body weight, and Australia gives 1.1 mg a litre. The World Health Organization suggests a maximum of 1.5 mg a litre. These numbers have a range because each country or organization has to account for varying ranges of fluoride intake from food and dental products. This could be fluoride-reinforced toothpaste, mouthwash, and food grown or artificially reinforced with fluoride. This abundance of sources is a problem. Fluoride can be toxic. There have been 3 events widely covered by the media, and these were in the United States of America. Each had a rate of 220 mg a litre. This is more than 110 times the legal allowable intake according to any regulation discussed so far. Other studies have looked at children's dental products. They found that 5 mg a kilogram for children under 6 is the safe upper limit. At a cellular level, studies show that 1.9 mg or 1 millimole of acute fluoride is inadequate to alter cellular function. These studies had to use 5 and 10 millimoles, that is between 10 and 20 milligrams, to alter cellular function. This is roughly 6.3 to 12.6 times the maximum concentration in drinking water. This had an adverse effect on kidney cells after 6 hours of exposure. This means the actual exposure risk is substantially higher than that again. The kidneys clear an average of 120 milliliters a minute. Over the course of an hour, the human body would remove 7.2 liters. This is the sum volume of blood in the body, and then some. This would lead to a drastic half-life of fluoride in a grown adult. Of the fluoride which gets to the kidneys, between 40 and 60% is cleared each time. Chronic exposure is a different beast again. This allows for greater ranges of exposure. This is cleared much sooner, where it is not absorbed in the GI tract or directly in the oral cavity. It can be generalized that 10 mg a day is the upper range for adult chronic exposure. This is only the comparison of artificially fluoridated water. Naturally fluoridated water is a similar but slightly different story. The quantities are rarely subject to any kind of controlled release or standardization. For these reasons, fluoride is also removed from water in some places. Most often, it is a combination of calcium and fluoride which form a compound. This has a calcium core and 2 fluoride arms. In high, chronic doses, this can detract from bone density. By demineralizing the bones, the structure begins to fail, as it does with osteoporosis. Fluoride can be removed from water by the addition of calcium, such as that in cheese making. In a public utility, this would be an industrial concentration or similar. In private water supplies, it can be handled a number of different ways. If it is a private water supply, alternatives such as distillation and exposure to the open air may be favored. More technical and thoroughly discussed methods include membranes, reverse osmosis, dialysis, and more in the link below. This leads to a simple question: is fluoridated water of benefit? In children, fluoridation has been shown to have a reduction of up to 60% in caries, but newer data indicates a figure that is closer to 20 and 29% in the United States of America, water fluoridation being comparable in efficacy to any other delivery mechanism within a small margin of error. In Europe, this figure sits around 15%. Neither study group has used a stringent study design. However, the evidence does show that stopping fluoridation is followed by an increase in cavities. This is consistent with data that was found in a 2007 Australian study. To summarize all of the minor and inconsistently designed studies, a Cochrane review has been linked below. This concluded that there was a 35% reduction in cavities in children's teeth and a 26% reduction in adults' teeth. This is a substantial impact on the demand for dental services and on oral health. However, the evidence was again flawed. Given the kind of evidence that has underpinned the use of fluoridation to date, there is a remote possibility of poisoning through acute and chronic exposure. What then is the reason for fluoride to be used? Simply put, it helps the enamel covering teeth recover from cavities. Over time, the enamel is broken down by chewing, acidic food, and the activity of plaque. This can lead to cavities if left untreated. The calcium is broken free by the acidic components of these. This leads to a deepening of fissures and folds in the enamel. This opens more opportunity for bacteria to take hold, which creates a worsening cycle. Enamel is fundamentally a composite of minerals. This compound is made primarily from calcium. Fluoride is useful for keeping calcium around the enamel. This is because it acts very much like a coating and reservoir, mostly as a coating over the teeth and suspended in saliva. This pool of fluoride then covers the quasi-cavity. This patches the damage temporarily. The tooth then begins refilling the cavity from below. This prevents the rate at which a cavity grows. Under the right circumstances, and these would be the ideal circumstances, the rate at which damage is done can be outcompeted by the rate of repair. Fluoride is not necessary in all cases. The use of fluoride in dental products, like toothpaste, reduces the need for a universal source of fluoride. This is not beyond the safe drinking levels, but it is a substantial increase over what would normally be consumed. Well, that is unless you start drinking a tube of toothpaste each day. Toothpaste has an average of 0.312% fluoride. In a 100 gram tube, this is 0.3 grams or 30 micrograms. An entire tube of toothpaste would be a substantial and acute dose of fluoride. However, the amount used on a toothbrush is substantially less, and considering the number of uses you would get out of it, it is a very, very small increase on your daily consumption of fluoride. This is true of developed nations, where the need for such sources is much lower as they are readily available in other formats. This is particularly true of oral hygiene products, toothpaste, mouthwash, and similar. In developing nations, or regions with limited water, it is not true. Either an excess or insufficient supply of fluoride exists. Here, fluoridation has a direct need and purpose. These regions often lack the same level of access to dental services. Fluoridation provides a considerable benefit in the reduction of cavities for these groups. Not everyone believes that fluoride does any good, and not just that it is not effective, but that it has a direct and adverse effect on people. The more imaginative ideas are exemplified by Alex Jones, as you can see here.
Look it up for yourself. I mean, this is what do you think tap water is? It's a gay bomb, baby. And I'm not saying people didn't naturally have homosexual feelings. I'm not even getting into it. Quite frankly, I mean, give me a break. You think I'm like, shocked by it, so I'm up here bashing it because I don't like gay people? I don't like them putting chemicals in the water that turn the friggin' frogs gay. Do you understand that? Serious crap. I'm sick of being social engineered. It's not funny.
This is not a limited concept, but an example of the lack of evidence to substantiate arguments against fluoride. So, fluoride does not directly stop cavities, but it does slow them down enough when fluoride is available in sufficient quantities. It acts as a pool of material to protect teeth. The risk of toxicity is low because the quantity needed and what is available in both regulated drinking water and in other sources is well below any threshold that would cause harm. It does provide a degree of benefit to children particularly, and prospectively covers adults to a certain extent, if not as much. For this reason, continued investment and use of fluoridated water makes sense. Thank you for watching this video. Please post any comments, questions, or suggestions you may have below.